We will be continuing, this being the second video in our urinary system series. As we look at the kidneys, we would have to, in an organism, lift up all of the organs, and there would still be tissue that we would have to tear through. That tissue is the peritoneal tissue. So the kidneys are retroperitoneal, meaning they are behind the peritoneal tissue. They're attached to the posterior body wall right below the 12th thoracic rib. So just the lowest ribs. You can feel that on your back. Renal ptosis is when the kidneys drop due to inadequate support. It can cause a kink in the ureter. This typically happens in older individuals, individuals who are anorexic, individuals who have lost a lot of weight. Then that peritoneal is not holding the kidney in place tight enough. It's become loose because of that loss of weight. And then the kidney can float, move around, and can cause the ureters to kink up. The function of the kidney is to regulate the pH, to remove nitrogen waste, to help regulate blood pressure, to excrete excessive metabolic substances, to maintain water balance, to secrete erythropoietin. Erythropoietin is used to stimulate the red blood cells to form, and it helps in synthesizing vitamin D. There are 3 layers of tissue that surround and support and protect the kidneys. The renal capsule. The renal capsule is the innermost layer. It's primarily a barrier to infection. The adipose capsule is the fatty tissue that holds the kidney in place. The renal fascia is the thin membranous connective tissue that anchors the kidney to the body wall. The interior anatomy of the kidneys, the cortex is the outer layer, the medulla is the inner layer. The medulla is where the renal pyramids are found. And then the renal pelvis is where the major calyx empties into and the ureter enters into the kidney. Looking at a cross-section of the kidney, the very outer thin layer that covers the kidney is the renal capsule. This area right here is the renal cortex. From here in is the renal medulla, and you've got it labeled there. The triangular structures are the renal pyramids. The tip of the renal pyramid is the renal papilla. In between the renal pyramids are the renal columns. Right here is the minor calyx. Our minor calyx empties into a major calyx. The major calyces empty into the renal pelvis. The renal pelvis is the area where the urine can flow down into the ureter. We have the renal arteries, we have the renal veins. This does a nice job showing you where the cortex and the medulla are. Again, the pyramid, the papilla, the columns, the minor calyx, major calyx, the ureter, the pelvis. This area right here, it's showing you how the kidney is kind of bent inward there, and that is the hilus. That's kind of the when it's kidney shaped or bean shaped, that's that indentation that we see there. Here you can see what the kidneys would look like on a sheep kidney. So you can really see those pyramids. You can see the renal cortex nicely. You can see the ureters right in there. Here we have the renal pelvis. The tip of the pyramids is the papilla. In between the pyramids are the renal columns. Again, this is going to be where you would have your ureter, renal pelvis, this outer covering here, and you can see it right there, how thin that is. That's the renal capsule. Here's the cortex. You can see the medulla. Within the medulla is where you're going to see your pyramids. Tip of the pyramids is the papilla. They're going to open into the minor calyx. Can't really see the major calyx here. You can see the renal pelvis. Looking at the ureter, it's 10 to 12 inches long. It runs from the kidney to the bladder. You have two because you have two kidneys. The ureters will enter the bladder at the base, and they're going to enter in such a way that during the pressure of urination, the ureters are going to be compressed and closed. And they're going to be compressed and closed because we don't want backflow of urine going back into the ureters. This will prevent any bacteria from spreading and prevent bacteria from causing bladder infections. Now the ureters work through peristalsis, which is that wave-like contractions. This is going to carry the urine from the kidney to the bladder. If an individual has kidney stones, many times what happens is those stones get stuck in the ureter, and they're blocking the urine, and they're very painful because when they pass, one, they're very large, two, they're blocking the urine from passing, which makes it uncomfortable, and then three, they can be jagged shaped so that when they're moving through the ureter, they're actually scraping the insides and causing pain and discomfort. The ureter attaches to the bladder. The bladder is retroperitoneal, meaning that you must lift all of the organs and tear through the peritoneal tissue in order to reach the bladder. It has a maximum capacity of between 700 and 800 milliliters. It's posterior to the pubic symphysis, anterior to the rectum, and it's a collapsible hollow sac. So that means it has a new type of tissue it's composed of, and that's called transitional epithelium. The transitional epithelium allows the bladder to expand and then to contract. So it's made up of a combination of squamous type cells and cuboidal type cells. So we call that transitional epithelium. The urethra is attached to the bladder, and this is where the waste will lead. So it's from the bladder to outside the body. It is about 1.5 inches long on females and about 8 inches long on males. Because it's shorter on females, females are more prone to bladder infections. It has two sphincter muscles. The internal urethral sphincter muscle, which is involuntary, this is the one that signals that you need to go to the restroom. The external urethral sphincter is the one that you control. So when you say that you're holding it and you need to run to the restroom, this is the one that's under your voluntary control. Here we have an overview of the urinary system where we can see the inferior vena cava, we have the abdominal aorta, we have the kidneys, the adrenal glands, the renal arteries and veins. Coming on down, we have the ureters going from the kidneys down to the bladders. We have our bladder, and then we have the urethra. The scientific term for needing to urinate is called micturition. It's both voluntary and involuntarily controlled by the nervous system. There are two sphincter muscles that control the opening of the bladder to the urethra. The internal most is involuntary. It opens up when the bladder is 1/4 to half the way full. This is the one that signals you need to go to the restroom. The external is under voluntary control, and this is the one that it develops around 12 to 18 months of age. That's why infants typically cannot be potty trained before 12 to 18 months. Incontrol or inability to control urination is called incontinence. It can be due to age, too young, too old. It can be due to nerve or muscle damage. It can be due to physical or emotional strength. So there's a variety of reasons that one may not be able to control urinating.